What are the normal triglyceride levels? Doctors generally consider normal triglyceride levels to be below 150 milligrams per deciliter of blood. When triglyceride levels are higher than normal, doctors often advise dietary changes and increased physical activity. However, if triglyceride levels are extremely high, doctors may recommend taking certain medications. Various factors may affect triglyceride levels, including genetics, medications, and dietary habits. High levels of triglycerides can increase the risk of various health conditions, including cardiovascular disease. This video explains what triglycerides are and the categories that doctors use to define the levels. It also discusses the causes of fluctuations in triglyceride levels, as well as the risk and treatment options. Triglycerides, normal to high levels. Triglycerides are a type of fat, also known as lipids, in a person's blood. When a person eats, the body converts any unneeded calories into triglycerides for later use, such as between meals when the body needs energy. If a person regularly ingests more calories than their body needs for energy, their levels of triglycerides may become elevated. Doctors classify normal to high levels as follows, which you can see at the screen. Normal, less than 150 milligrams per deciliter. Borderline high, 150 to 199 milligrams per deciliter. High, 200 to 499 milligrams per deciliter. Very high, 500 milligrams per deciliter and above. What causes the levels to fluctuate? The National Heart, Lung and Blood Institute state that certain medical conditions, lifestyle practices and medications can cause triglyceride levels to increase. Genetics may also play a part in determining a person's triglyceride levels. Medical conditions. Some medical conditions may affect triglyceride levels. This include thyroid disease, kidney disease, liver disease, diabetes, obesity. Dietary factors and exercise habits. Some lifestyle factors may contribute to high levels of triglycerides, including physical inactivity, excessive alcohol consumption, eating a diet high in sugar and fat. Medications. Medications that may affect triglyceride levels include those that doctors prescribe for HIV, high blood pressure, breast cancer. Risk of elevated triglyceride levels. Having high triglyceride levels can increase a person's risk of various health conditions. This include cardiovascular disease, metabolic syndrome, pancreatitis, and fatty liver disease. Cardiovascular disease. The Centers for Disease Control and Prevention note that high triglyceride levels are linked to an elevated risk of heart attack or stroke. If a person also has low levels of high density lipoprotein or HDL cholesterol or high levels of low density lipoprotein LDL cholesterol. Metabolic syndrome. According to the National Heart, Lung and Blood Institute, high triglyceride levels are one of the risk factors for metabolic syndrome. Metabolic syndrome raises the risk of stroke, heart disease and diabetes. Doctors may diagnose metabolic syndrome in someone who has at least 3 risk factors, including a large waistline, high blood pressure and high triglyceride levels. Pancreatitis. Researchers note that very high triglyceride levels pose a significantly increased risk of pancreatitis. They add that the risk of hypertriglyceridemia related pancreatitis may be especially high in people who have uncontrolled diabetes. Fatty liver disease. High triglyceride levels may also lead to fatty liver disease, which is a buildup of excess fat in the liver. The condition may result in inflammation and liver damage, causing scarring and possibly liver cancer. Test for elevated triglycerides. Doctors check triglyceride levels with a lipid profile, which they may refer to as a cholesterol test. In addition to measuring triglycerides, the test measures levels of HDL, LDL, and total cholesterol. The CDC stated that a person having the test may need to refrain from drinking and eating for 8 to 12 hours beforehand. They also recommend the following. Healthy adults should have this test every 4 to 6 years. People with diabetes, heart disease, or a family history of high cholesterol should get the test more often. Children should have the test at least once between the ages of 9 to 11 years. Young people should have another test between the ages of 17 to 21 years. Treatments. People can often lower their triglyceride levels by making dietary changes and exercising more, although some individuals may need prescribed medications such as statins. A doctor may suggest other medications for those with triglyceride levels that are very high or remain high after statins medication. Lifestyle changes. Doctors may recommend that people with high triglyceride levels take the following steps to lower them. Reaching or maintaining a moderate weight. Moderating alcohol intake. Getting at least 150 minutes of exercise per week. Quitting smoking if a smoker. Diet. A nutritious and healthy diet typically involves eating foods high in protein, fiber, and healthy fats. A person can try increasing their intake of lean meats, yogurt, and low-fat cheese. Fruits, vegetables, beans, nuts, seeds, and whole grains, avocados, and olive oil. At the same time, it is important to limit the intake of foods high in salt, sugar, and saturated fats such as those in fatty meats and palm oil. Medications. If lifestyle and dietary changes do not lower triglyceride levels, a person's doctor may initially advise statins based on the recommendations of the American Heart Association and the American College of Cardiology. They may also prescribe omega-3 fatty acids. If a person's triglyceride levels are particularly high or remain high after treatment with statins, a doctor may prescribe fibrates, which research has shown can lower triglycerides by 25 to 50%. Fenofibrate is generally the recommended drug. When to speak with a doctor. After a lipid profile test, a healthcare professional will notify a person about their results. People with triglyceride levels in the borderline or high categories should talk with their doctor to get an individualized plan. A doctor will consider a person's other health risks and medical conditions when determining whether to recommend lifestyle changes alone or include other treatments.